Content presented on the following show by any host or by any guest should be used solely for your entertainment and enjoyment. The views and opinions of the following show are not necessarily those of the Whole Care Network, other show hosts on the Whole Care Network, or advertisers on the Whole Care Network. Shows on the Whole Care Network are not intended to treat, diagnose, or claim to cure any disease or condition. Always consult a professional when making any changes to your physical, spiritual, mental, or financial health. And thank you for listening to the Whole Care Network.
Well, greetings everyone, and welcome to another episode of Healing Ties 2.0 featured on the Whole Care Network. I'm your host, Christopher McClellan. You just might know me as the Bowtie Guy. On Healing Ties 2.0, we visit with people from all over the globe who share their stories because it's through story sharing where diversity meets the road to collaborate on a common cause. And our common cause is supporting caregivers before, during, and after caregiving ends. Caregiving is not just a local issue. It's a universal issue that brings people together from diverse backgrounds and beliefs because the best information and referrals caregivers receive are from other caregivers who have been on their own personal caregiving journey, who understand where you've been and where you are going. And on Healing Ties, we take it a step further and ask, beyond caregiving, how do we care? How do we care for ourselves, our family, our neighbors, and our friends? How do we heal the social, the physical, the financial, the spiritual aspects of our lives? We do this by creating healing ties with each other. My guest today is author Ben Rayo. Ben's book, Paying for Long-Term Care, is the essential guide to understanding and funding senior care. You're going to hear a lot of terrific information and learn of the great work Ben and his team at Mom's House are doing to make understanding the maze of senior living just a tad bit easier. Well, not just a tad bit easier, a whole lot easier. And be sure to stay tuned towards the end of the podcast as Ben will provide you with information on how you can receive his book, Paying for Long-Term Care. Let's join my conversation with Ben. So Ben, welcome to another episode of Healing Ties, featured on the Whole Care Network.
Thanks, Chris. It's great to be here.
And we've kind of been juggling schedules, but we're doing it today. It's
Thank
okay.
Goodness for technology, right?
You never know. But as I'm prone to do, Ben, I have to ask all my guests, how are you creating Healing Ties?
That's a good question, Chris. I think I'm trying to create healing ties for families that are really going through what's known as crisis mode when they get the news that their family member can no longer live at home and they have to go somewhere where they're going to get 24-hour care. Many times, a caregiver hangs in there for a long time and it just becomes too much or something changes in the schedule. And so trying to get them a roadmap or a framework to help make that journey a little less stressful and a little easier. And hopefully along the way that we educate caregivers and adult children about what's coming for people as they age.
Very well said, because as we all know, and all of my listeners know, caregiving happens because one or two events. They're all unplanned. It's an untimely diagnosis or an unfortunate accident. And you're thrust into this role with very little information. And what do you do? And what happens as it progresses? And you have to make some of these hard choices.
Yeah, I'm amazed at the number of families, including myself, which I'm sure we'll talk about at some point, that just aren't ready for that flashpoint of when they get the news. Or it's the first step to say, we'll have a family member, son, daughter, uncle, spouse, something, say they'll be the caregiver because either care is too expensive or there's a heavy level of guilt about moving a loved one into somewhere besides their home or family's home.
Yeah, it is a tough decision that is not often talked about until you're in the middle of a crisis or an emergency.
Yeah, it's been a kind of interesting journey for me. I've been a serial entrepreneur for 20 years.
Mhm.
And so in marketing and technology and real estate investment, which is always a passion of mine. I love buying and flipping houses, or I've got a rental portfolio, and I take in a couple swings to do some commercial projects. But I sold a business at the end of 2017, and I bought an old post office in downtown Lee Summit, Missouri, which is a suburb of Kansas City.
So much, yeah. Know that well too.
I gutted that post office and I created a entrepreneurial incubator and co-working space for the city of Lee Summit to try to encourage entrepreneurs and small business owners to give them resources to help build their businesses better and keep jobs in our community and grow jobs in our community and cycle those dollars here locally. So it was a big passion project for me. And it was the first commercial project I'd done. And wow, did I did I learn a lot? That's what somebody says. Boy, it sure was expensive, but I learned a lot.
I sure was expensive. That return on investment, that ROI.
Yeah. And I shared all that with you because that was the platform of how I got into the senior living industry and into this industry is I had a company that I'd met a few years earlier at a networking event, group of entrepreneurs getting together for coffee once a month. And they were growing and they were the perfect fit to move into Bridge Space, which is the name of the incubator space. And they were here. And as I got to know them better and they got to know me better, they asked if I would do some consulting or contract work for them to kind of help them in some areas where they needed help. And I started to understand their model, and I really started to fall in love with the advocacy part of the business for
Right.
family solutions for care. And they invited me to be a partner in that business, and I accepted that. And so I became a partner in Family Solutions for Care a few years ago. And that company helps people that have a long-term care insurance policy. And when somebody that's been paying out a policy for 20 years thinks that it's going to be really super simple to move into a care community or get in-home health care, and it's just simply filling out a couple of pieces of paper, it's not that easy.
It's not that easy.
It's not. And if you get it filled out and you get it approved, which only about 1 out of 5 get approved on their first attempt. If you get it approved, they're certainly not going to tell you that if you just done it this way, we would have paid you more. Or if you'd sent this in and checked these 3 boxes, we would have gone back and paid for some previous care that you have. So my partners in that business came out of Genworth, which is, I'm sure you know, is one of the largest
Very familiar
long-term care insurance. And it's a really heartfelt company with about 20 employees, and we help families all over the country. And so when somebody has that long-term care policy, we do a free policy review to where we look at all the different data points in the policy, the care they're trying to go to. But the real value is being able to go back and look at the previous 2 years and put together and assemble, because we're HIPAA compliant, we can pull medical records and look at all the medical care that the family member received. And more than half the time, we're able to build a case and put it together to the insurance company that gets that family a retroactive refund. And on average, that's over $20,000. So that's money that families leaving on the table that they don't realize they can go get. A care community like an assisted living or memory care, or even in-home health's not going to go back and find that stuff. It's just not what they do. And so that's what we do. And we built an entire business on it. And then for the 12-month period, we actually go and file all the billing to make sure if any research come up or anything else that we help. So that's how I got really, really boring. From a product perspective, really exciting about working with families, because most of the time they're calling us, they're really stressed out. Many times they've tried to go at it themselves and just didn't realize how difficult it was going to be and what the consequences were of some of the things you might do during that process. So I got really excited and interested about it. It's been the most meaningful work that I've done being in the senior living industry. And that was kind of the beginning of stepping into the senior living industry. I was always around it though. My mom, and I grew up in Louisville, Kentucky. My mom was in the non-for-profit space, and most of that was in the senior space. And so I was always around it. So, and it was always interesting. I always felt like my mom worked way too hard and she was underpaid. I mean, she was, she was a one bad lady, and she was great at what she did, and she worked hard and provided a lot of value. And I always looked at it and said, gosh, Mom, you work so hard and you just aren't getting paid. And towards the end of her career, she ended up stepping into a larger role with a company and almost doubled what she was getting paid, I think. And then I think she looked at it and said, wait a minute, it's okay that I'm in non-for-profit, and it's still okay to get paid when you provide value. So, it was great to see her do that towards the end of her career, which helped really, bolster her retirement. Of course, she was in that business. She's got a really nice long-term care insurance policy, which, for me as a son, I'm like, go Mom, no stress for son when the time comes, which is part of the thing that's so crazy. So from Family Solutions for Care, I partnered with a gentleman out of St. Louis, your old hometown.
My old hometown, yeah.
That's it. And he had been doing real estate investment, which I was very familiar with, but he had created all these relationships with people in the senior living industry in St. Louis. And they started to see him as a resource to help solve a huge problem for the family. And it's the problem of, what are we going to do with the house? What are we going to do with the house?
It is a big problem.
You've got it. So listen the way this tees up. So you've got a house, you need to sell it. It hasn't been updated in 10 years, probably because Mom's there, spouse passed away. She's been living there for 7 years, not able to maintain it, just getting by. And the house is filled with a lifetime of stuff from kids, from other things, collections. That generation never threw anything out. They used it until it was good. The appliances are in perfect condition. The only problem is they're avocado. And right. And it's like, you've got all this, and it's like, wow, that's like a dream house for a real estate investor, because it has to be totally updated and things have to be replaced and cleaned up and maintained. And we don't mind dealing with stuff. So real estate investors are a great fit to come in and help the family, because many times, as you know, I'm in Kansas City. My stepfather was in Louisville, who got sick 6 years ago. Mm-hmm. I'll come to that in a second, but it's and a real estate investor can come in. And so we decided to build this entire business around teaching real estate investors how to engage with the senior living industry. And it's a company called Mom's House, momshouse.com.
Momshouse.com.
So we have taught hundreds of real estate investors all over the country and built a network of people that are senior certified specialists that understand the crisis and the stress and what the family's going through. They understand that the parents live 400 miles away. I'm sorry, the adult children live 400 miles away from their parents, and that they don't want to do a rehab job from remote. I've never been on budget doing a rehab job on myself. And I consider myself to be somewhat of a professional, right? It's like, you think you're going to do it? And you think you're going to rehab the house and fix it up and not be on time? And good luck finding a good contractor right now with a hot market. So, you put all that together and it becomes a really great service to come in and say, look, Chris, I know you're putting your mom into assisted living and you have the house and you don't want to rehab it. And here's the reasons why. I'll buy it. We can close in 2 weeks. We'll pay cash. You don't have to deal with any of the stuff. Just take anything that you want. We'll recycle, we'll throw it out, or we'll donate the stuff that we can. And we'll take care of all that. And don't worry about any of that hassle or burden. And there's no closing costs. And there's no ongoing costs that a homeowner might have for taxes and insurance and maintenance or any of the other mortgage payment possibly, or any of the other things. So we built an entire company on that. We've got a huge network that when somebody refers a family to Mom's House at momshouse.com, we get that in the hands of somebody that we think has been sensitized and understands what the family's going through and knows how to treat them with dignity, respect, and help them in that process. Those two companies really are what opened my eyes to seeing so many families that are just so unprepared with what's going to happen when they find out the news that mom or dad can't go back home. And so if you and I are brother and sister, and you live in the city where mom lives and I don't, and you've stepped up to say, okay, I'm going to move in with mom, or she's going to move in with me, and you're that caregiver, and you're the responsible child, and that puts a lot of stress on you and your time and your schedule and everything else when you have, and at some point that boils over, or if that whole process is skipped and mom is going to move right into assisted living or memory care, then you and I are talking to each other remotely saying, what are we going to do with the house? What are we going to do with all this stuff? When are you coming in,
problem, Ben? Sure.
When are you coming in, Ben?
Because when are you coming in, Ben,
right?
to take care of? When are you going to do your share of this? Right.
That's right. And then I either got to drive in or fly in, and then we got to go through the stuff. And you and I are like, oh, we're optimistic. We can get through all this in a weekend. We might even get through it and paint, right? Okay. And we don't get through the stuff at all. We don't make it and through it all. And it's so stressful. And I saw so much between both of those companies that, as any entrepreneur would, I said, I'm going to figure out a way to help solve this problem. And so I decided I'm going to write a book. I'm going to write a book to help solve this. And you know what? There were people that said, what do you mean you're going to write a book? What do you know about this? I said, well, my stepfather was sick, and I know I tried home health, and then it didn't work. After 90 days, we realized that wasn't going to work because I wanted to keep him at home, and I didn't want to send him to the nursing home. So then I had to research assisted living, which I knew nothing about or how to compare it. And I didn't know anything about Medicaid. And I didn't know about what spend down was. And I wasn't sure if he was going to, if VA aid and attendance was going to kick in.
Exactly.
I didn't know.
Another confusing component of this whole mix.
Yep. And we still have to deal with the house, and it's filled with stuff. And I have to drive 8 hours to get there. And I'm coming in 3 weekends a month to come in to visit him and not to deal with stuff, because I know his health is degrading very quickly. And I went through all that, and then we brought him back home for hospice, and he passed in his home, which was great. I had a half sister that was there, and she had a lot of that burden put on her, and that's pretty common. I realized I'd been through that, and I didn't know what I was going through at the time until I'd gotten into the senior industry and said, oh, that's what I was going through. So I created a framework in the book, Paying for Long-Term Care, just to give a guide, or at least a little bit of some guidance or a roadmap for families to say, look, here's the 5-step approach. Just follow it. And if you do, you're going to be way better off than if you're going to try to do this by yourself.
It's an essential guide.
It is essential. It is. And it's, you know what? And people have read it and said, I had no idea there was this much available. I had no idea there was this. Thank you. Because I try to hit it to say, hey, first thing we got to do is we got to figure out what level of care they need, not picking a community. And we pulled a third-party software product that we run on the website. It's free, that allow people to go through it. It's from a tool called Rubric. A lot of care communities use it. It just kind of gives you a guide on where you need to go. Then the next piece is the assets. It's like, what assets do you have? And of course, my stepfather didn't keep track of stuff. He wasn't a huge fan of banks. He had a bank account, but he had stuff on paper. It was in the basement. The basement got flooded, so it's just like you're trying to find all the different things that the loved one has from an asset. And so gathering those together, and then of course, suggesting in the book to say, look, you need to have these conversations now when you can to understand what your loved ones have. So if this happens, it reduces stress. You get to care faster, which is really the goal here. Then once you get past those two things, we need to go in and say what options are available. And that's about what 40% of the book's about. It's about what options are there. Is it insurance? Is it life insurance? Is it, savings, retirement, a house, VA aid and attendance? I'm amazed at the number of people that are veterans that have no idea that's available. And it would make sense. The spouses don't know that it's available, but even the veterans themselves. So now that the veteran dies, some number of years before the spouse typically, and the spouse is not even thinking I should be getting benefits for my husband or wife that passed, and not realizing that there's money.
Not realizing that it's there.
Yeah.
Once you get into the veteran system, once you're in, it's great. But getting into it and knowing what could be available for it, that's why your essential guide is so important.
The Medicaid thing, we don't have time for that, but a lot of people.
Oh my God. We could do a whole segment of shows on.
You could.
And I'd be happy to do that with you.
And a lot of people think, well, I've got Medicare. I'm all covered. And they don't realize that Medicare is not going to cover long-term care expenses.
Not going to happen.
So, I try to hit those things to open up some people's eyes. There's some other creative things. If people are listening and they've got an HSA, there's things where you can move your, all right, disclaimer, I'm not a financial planner.
There, I was going to go there.
I'm not an insurance broker. I am not a doctor. I am, this is not financial. This is not advice. This isn't medical advice. This is no advice whatsoever, besides a guy that's been through it and then has had some experience in the senior living industry to say, look, we can try to make this journey easier for families. So, health savings account, HSA.
Yeah, HSA. Yeah.
There's actually something called a self-directed HSA. And so you could put money into the self-directed HSA, and then that HSA could invest in whatever you decide to self-direct it to. So I can do a real estate investment deal out of my self-directed IRA, or I could do a real estate investment deal out of my HSA. Sounds insane, right? Mm-hmm. But if I get enough money into my HSA, and I match that up with, this is a whole nother conversation, non-recourse lending, then I have the ability to go buy a house that could be a cash flowing asset in my HSA, and that money goes back to my HSA. And now I have a way to exponentially grow my HSA, which I can use for what? I can use it for healthcare expenses. I can use it for long-term care. I can use it for other things. So somebody now in their 50s or 60s to have an income producing property in an HSA would be an amazing way to get way fat in your HSA versus just putting the $5,000, $6,000, $7,000 a year that you can put in depending on your age. So,
right.
I talk a little bit about some of that kind of stuff. And then after the kind of once you know how you're going to pay for it, then you start going to look for what kind of care do you need? Then what can you afford? What do you need?
What do you need?
And you kind of have all that put together. And then getting the family on the same page. And then the last piece is to transitioning the family member into care. So that's kind of the runway or the roadmap that we built through those 5 steps, and talk about a lot of different things, both emotionally related, financially related, and just things.
It is an emotional, right? Over and above being an entrepreneur, Ben, you're an advocate.
I guess I have been. I guess I've become
an advocate.
I guess anything that you're passionate about, that's what you sort of become, right? I've just evolved into it, not necessarily, not purposefully, just a mindset of I can go solve the problem. Now, how do I get the book in the hands of, and the resources in the hands of millions of people that have no idea it's available and no idea what to do? I don't know how to solve that. That was never my original goal. I never let myself dream big enough and be limitless enough to say, look, because this thing started like, I'll get it in the hands of, a few thousand people and we'll help. And then it's like, how do we get it into 10,000? Then it's like, I'm knocking on the door, trying to knock on the door. Anybody from AARP, if would please answer the door for Ben Rayo, I'd appreciate it, because I feel like that this would be like amazing.
I've been knocking on that door for years myself.
It's a big door, but you know what? I'm going to keep knocking on it. It's
That's what you got to do. Keep knocking.
That book would be such a great resource for AARP members, because they're either dealing with their parents or they're headed that way soon.
And let all listeners know how they can get a copy of the book.
You can go to payingforlongtermcare.com. That's payingforlongtermcare.com, and just click on the book there. There's you can purchase it there, or there's also an ebook. You can find me pretty easily on LinkedIn. First name is Ben, Ben. Last name is Rayo, Rao. And my email. You want me to give my email out, Chris?
I would say go for it.
Okay.
Because it's going to be in the show notes and in the blog post and all the follow-ups.
So you can email me if you'd like at brao@payingforlongtermcare.com. I'd love to help you and your family if I can, or I have hundreds of relationships across the United States with VA aid and attendants, Medicaid, placement agents. One of the things I do talk about in the book is trying to give some advice or guidance to families to, the first step should not be going onto Google and putting assisted living or nursing homes near me.
Very exactly.
You're going to find yourself in a web of companies that would be collecting information to try to connect you with different resources, and might end up getting, a whole storm of phone calls just to add more stress to the
just
families.
to add more stress to you.
And I talk about that in the book a little bit. It's just some of it's as simple as just looking at the URL that before you put your information into a form somewhere,
Right.
make sure it's the care community that's in your backyard. The placement agents are great resources because they know the care communities and local.
Yeah, the local placement agents, yes.
They are. And there's independent placement agents. And then there's also 3 or 4 franchises that we have relationships with nationally, which are all great companies. So there's a lot of resources that people don't know where to go. And usually it's because they're just like, it's crisis mode and I don't know what to do and where to go. And what do you mean it's going to cost $5,000 a month? And mom didn't have that much money, but we're not sure if she did because we don't know where it is. And
we don't know where it is.
Right, exactly.
It's under the mattress.
I talk about this in the book. My stepfather was one of those guys. He put money around the house in different places. And I found a big stack of hundreds wrapped in foil in the freezer when I was a kid once. I was like, what is this? I was looking for pizza. And it was a huge stack of hundreds. I opened it up. I was like, oh, I thought it was like drug cartel or something. Nope. He didn't like banks.
He didn't like the banks. That would be quite a topping on your pizza.
Yeah, it would.
Goodness. Well, Ben, with the great work that you are doing, you are certainly someone that's creating healing ties all around us. I could talk to you for hours.
I really appreciate you having me on your show and helping me to spread the word. It's a great resource for people. I hope it can touch, just one little tidbit out of that book, I know will change the trajectory of families, both emotionally and financially. So, and if anybody doesn't have $14.95 or whatever that costs to buy that book, you email me directly. I'll ship one out to you, but don't be taking advantage of me for handling and shipping and all that. I'm just saying if somebody's really in a tough spot, they can email me or reach out to me, and I'll have my team just mail the book to you.
I've had the opportunity to read Ben's book, Paying for Long-Term Care, and the information that he shares is essential to help you make good decisions for your loved ones as you maneuver the maze of senior living. Well, that does it for this episode of Healing Ties. As you know, I'm your host, Christopher McClellan. Just might know me as the bow tie guy. I've created a life to love after caregiving ends by being with awesome people like Ben Rayo and our listeners like you. Thanks for joining us today, and be sure to subscribe to Healing Ties wherever you listen to your favorite podcast. We'll see you for another episode real soon. Bye for now.